Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. While we may not know exactly how many hurricanes may hit the Gulf South this season, one thing is certain: it's never too early to start preparing and planning to keep you and your family safe. In our first segment, we'll return to some tips we provided last year for keeping your health a top priority, how to prepare your home for hurricane season, and what to do specifically before, during, and after a storm. And in our Community Health Heroes report, we're going to Ochsner Medical Center to talk with the director of Ochsner's Comprehensive Stroke Center, Dr. Gabriel Vidal. He'll tell us what you need to know about strokes, the symptoms to look out for, why women and people of color are at a higher risk of getting a stroke, and how you may be more likely to get a stroke during the hot summer months. And in the kitchen, Executive Chef Loma Xayalinh of Tsunami Sushi, New Orleans, will be showing us how to make a tasty Eat Fit NOLA approved Thai beef salad with sliced seared beef, cherry tomatoes, cucumber, cilantro, red onion, bean sprouts, carrots, and Vietnamese dressing. So don't go away. We'll be right back with more Community Health Heroes.
Attention travelers. Next Tuesday, a major power outage will cause complete chaos throughout the city. Water, phone, and internet service will be in short supply. There will likely be panic citywide. Stand clear of the closing doors, please.
Disasters don't plan ahead. You can. Talk to your loved ones about how you're going to be ready in an emergency. Don't wait. Communicate.
Welcome back to Community Health Heroes. Did you know forecasters with the National Oceanic and Atmospheric Administration are predicting 9 to 15 named storms, 4 to 8 hurricanes, and 2 to 4 major hurricanes for the 2019 Atlantic hurricane season? They say it should be a near normal season, but El Nino and a warmer than average Atlantic will help shape this season's intensity. Here are some preparation tips we suggested previously during hurricane season last year. It's always a good idea to prepare for at least a 2 to 3 day evacuation trip, which means bringing enough clothing, food, and water for you and your family, and some fun items like toys and DVDs for the kids to keep them occupied. Make sure to bring your medications, about a 2 to 3 week supply, and bring important medical records, your eyeglasses, hearing aids, dentures, crutches, canes, and walkers, first aid supplies, personal hygiene items, and other important things you might need while you're away from home. Now, before a storm, check your batteries, flashlights, and radios. And remember to power up your phone, computer, and other mobile devices. And check your generator if you have one. Make sure it's ready to work and stock up enough fuel for at least a week. Know the locations of shelters in your area and know who to contact if you don't have transportation. You can make a communications plan for your family by selecting someone from out of the state and telling them when you plan to evacuate and where you're planning to go. Send them all the contact information for other people who should know as well. Think about how you're going to transport babies, pregnant women, the elderly, and family pets, and always keep your car in good repair with a full tank of gas. If you can, keep a stash of cash in case there's a power outage and ATMs go down. Remember to close your storm shutters and store outdoor items that could get damaged or picked up by the wind. And try to reinforce your garage doors. Turn the refrigerator to its coldest setting and keep the doors closed. Just prior to the storm, turn off your utilities and all gas. Get candles, matches, flashlights, batteries, and a battery-operated radio and put them in a safe and accessible place. Store drinking water and water for flushing the toilet and taking baths. Fill the bathtub, pots, and clean pails with water and keep in a secure place. Now, before and during a storm, follow changing weather conditions and stay tuned to the radio, TV, or online reports. You can listen to the Louisiana Emergency Alert System broadcast in New Orleans on WWL 870 AM and sign up to get emergency alerts at NOLA Ready, and that's at ready.nola.gov. It's a division of the Office of Homeland Security and Emergency Preparedness. There, you'll learn about city-assisted evacuations, be able to sign up for a special needs registry, get traffic information and street flooding reports, and get seasonal information about how to prepare for an emergency. Again, that's at ready.nola.gov. Also, remember that contraflow lanes are not for local traffic, but for getting out of town as fast and as safely as possible. Follow the signs and directions carefully. After a storm, walk around your house to survey any damage or hazards. Stay away from downed power lines and report them to utility companies as soon as you can. Hopefully, none of us will have to evacuate for a storm this season, but it's always good to keep this kind of information in mind this time of year.
When I was 6, my days were spent playing basketball. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to spot a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
Protect the ones you love.
Spot a stroke fast.
Did you know that stroke is the 5th leading cause of death in the U.S., and strokes cause disability in about 2/3 of survivors? And you especially need to take precautions in the summer months because dehydration could lead to complications that make it easier for a stroke to strike. The death rate for stroke is highest in the Southeast, but not at Ochsner Medical Center. The Ochsner Neuroscience Institute's Comprehensive Stroke Center has become a destination center for stroke and neuroscience patients throughout the Gulf South region. And it's where patients survive at rates that exceed even the national expected norms. Dr. Gabriel Vidal explains why and much more in this Community Health Heroes report. At Ochsner Medical Center in New Orleans, vascular and interventional neurologist and director of the Comprehensive Stroke Center, Dr. Gabriel Vidal, helps patients from around the Gulf South who get a stroke. Usually, only 3 or 4 hours stand between a stroke occurrence, lifelong complications, or death. At Ochsner, Vidal's team can often buy patients more time.
At Ochsner, for example, we have different tests that we can do that we can identify that patient population that can benefit from acute treatment past the traditional 3 to 4.5 hours in which we normally are able to treat a stroke. And if we find somebody who has the tissue that still hasn't suffered permanent damage, it can be even up to 24 hours. If we can identify it and we can treat that stroke patient and maybe reverse the symptoms completely, or at least give them the benefit or the opportunity to have a better outcome than if they were not treated at all. But most of the strokes would be treated inside 3-4.5 hours. So it's really important that even some people may have 24 hours, it doesn't matter. You need to make it to the emergency room as soon as possible. Again, the more time you give us, the quicker you get, the more time you give us to treat the stroke, and the better your chances will be to have a better outcome.
Vidal's Comprehensive Stroke Center uses a telestroke program where emergency department physicians in rural and urban hospitals have the ability to consult immediately with Ochsner vascular neurologists and stroke specialists 24 hours a day, 7 days a week, using telemedicine equipment through Ochsner's Care Connect 360 to determine the best treatment options for stroke patients.
The telestroke program is a way that we have to provide stroke care to areas that don't necessarily have stroke specialists. At Ochsner, we've partnered with multiple hospitals, over 50 hospitals, in fact, across the state of Louisiana, Mississippi, and even Alabama, to provide that service.
At its worst.
So let's suppose that you show up with stroke-like symptoms in a rural hospital. They don't have anything but a small hospital in town. So we are able to evaluate and give recommendations of treatment of that patient just using the camera and audio. We can communicate with the providers at the spoke. We can share imaging studies that are done at that study so that we can provide the appropriate recommendations. And if the patient qualifies or meets the criteria for advanced treatment, then they can actually be transferred over or flown over to our facility so that we can provide that care for those people.
Even though there are different types of strokes, Dr. Vidal said a stroke generally occurs when a clot blocks the blood supply to the brain or when a blood vessel in the brain bursts. At that point, you have just hours to get to the hospital to seek treatment because without blood flow, brain tissue starts to die. The longer you wait to get treatment, the less likely it is that you could recover from life-altering complications. But first, you need to know what to look out for.
It could potentially be very easy to spot. They're very characteristic symptoms like weakness of one side of your body, or slurred speech, or difficulty communicating, or difficulty walking. Now we have a mnemonic, or little phrase that we use for people to remember or to learn the signs of stroke. It's FAST. F stands for face, or facial droop, slurred speech. A stands for arm. In this case, it will be arm or leg, and you have weakness on one side of the body. Again, S, once again, for speech, if you're slurring and the words won't come out, or people don't understand what you're saying. And then T on the FAST would be for time. It is extremely important that once stroke symptoms are identified, that you call 911 and you make it to the hospital as quickly as possible. The quicker a physician or provider can get to a stroke patient, the better the chances are that the symptoms can be reversed and that the damage is minimized. In a best case scenario, you would go to a hospital who's equipped to handle strokes, and the emergency department team will immediately identify those. Even the EMS might identify and notify ahead of time. And once you're in the hospital, you get a CAT scan to look at your brain and make sure you're not having a bleed in your brain. And then a team of vascular neurology specialists, whether they're providers or residents or advanced practitioners, will come evaluate you and administer the appropriate treatment. After that, the important thing is to determine what caused you to have your stroke. Once we know you had a stroke, it's fine, we'll deal with that, but we need to know why it happened so that it doesn't happen again, or so we make it less likely to happen again. And once we identify that as well, the next big step will be to rehabilitate, to try to get our patients to as close as normal as we possibly can, so that they can resume their lives as best as they can.
Dr. Vidal said stroke is the third leading cause of death for women and can have a more negative and long-term effect since they generally live longer than men.
So the hormonal changes that women go through their lifetime can alter the consistency of the blood and may predispose you to have some strokes. Hormone replacement therapy is a risk of stroke. Pregnancy could cause some coagulation problems which could lead to strokes. For the most part, they will present in the same way as anybody else. Man and female will present with the same symptoms, but there are times in which they would be at higher risk for having a stroke than men would. Regardless, there will be the same risk factors for everybody else as well, like having high blood pressure, diabetes, high cholesterol, smoking, drugs, not having a healthy lifestyle. All those sort of things will put you at risk for stroke, regardless of your age or sex or race.
Can you tell me what you can
The National Stroke Association finds people of color are at a higher risk for stroke, get them at younger ages, and suffer more severe cases.
Well, African Americans as well as Hispanics share a lot of common backgrounds, right? And so we are more prone to have high blood pressure and diabetes than Caucasians. So it puts us at a slightly higher risk than it would of the normal population. Sickle cell anemia is common in the African American population. It's just genetic and it gets passed through generations. And what happens with that is that the red blood cells are not in the same shape as they should be. They're not a normal shape. They're kind of like crescent. We're familiar with crescent here in New Orleans, right? And so they sort of get stuck in some of the smaller blood vessels and it can impede the flow. So it can put a patient at a higher risk for having a stroke because of that. At the same time, it may actually damage some of the blood vessels as it goes through, and it can actually cause the potential for having bleed in the brain as well.
Dr. Vidal said there's even a higher risk of getting a stroke in the summertime, and that getting or not getting a headache may not always be a reliable symptom.
But certainly because it is so hot, some of the patients may forget to stay well hydrated, and so that certainly can contribute to having a stroke. If you don't, your blood can get a little bit thicker because you don't have enough fluids on you. So certainly it is something that one should consider during the summertime to stay well hydrated. Stroke. There are certain types of strokes, like a subarachnoid hemorrhage, for example, whose presentation is exactly an exquisitely horrible headache. But there are strokes like ischemic strokes, which most of the time you will not feel any pain. You would just feel weakness or inability to talk.
According to the National Stroke Association, 80% of strokes can be prevented. Doctors at Ochsner say you can reduce your risk by quitting smoking, keeping your cholesterol, blood pressure, and diabetes in check with regular screenings and medications, and striving to eat a heart-healthy diet, get regular exercise, and maintain a healthy weight.
A huge or massive stroke can cause a lot of damage on somebody for the rest of their life. So getting to it quickly and with the right tools and the right techniques to try to reverse the effects could not only save their lives, but it could save their output, their outcome of life, and the things that they can accomplish in life.
Opiates has taken everything and everyone I've ever loved away from me. If making my detox public is going to help somebody, I'm all for it.
I'm Molly Kimball, registered dietitian and founder of Ochsner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on our restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away. Community Health Heroes will be right back.
Tsunami Sushi in New Orleans specializes in sometimes funky, sometimes fancy, but always flavorful sushi. But today, executive chef Loma Xayalinh will be preparing an alternate and popular dish, Thai beef salad. So we're holding the fish and loading this dish with fresh vegetables and Vietnamese dressing. Also, we have, of course, our Eat Fit NOLA registered dietitian, Lauren Hewlin. She's joining us to tell us why this flavorful salad is healthy, nutritious, and a convenient dish to make at home. So thank you both so much for being here. This is really exciting because even though it's Tsunami Sushi, you're going to kind of make an alternate dish. So you're going to prepare some beef here. Tell us exactly what this dish is called and what's in it.
This is our Thai beef salad. It's a very light, clean, refreshing salad, kind of an opening appetizer. It's not too heavy. A lot of bright flavors, fresh vegetables, very clean dressing, also very nice clean seared beef that we cooked. Literally, it's just a sear that's sliced over with cilantro.
I got you. And you're going to actually be slicing some up now and searing it for us?
Yes, yes.
And Lauren, tell us a little about Tsunami Sushi. I mean, obviously there's a lot of sushi dishes, but some, non-sushi dishes as well, and a lot of Eat Fit approved items. I hear that because there are some modifications, you can make almost everything at Tsunami Sushi can be Eat Fit approved. Is that right?
So definitely on their menu that you can see the Eat Fit seal on a lot of items. I don't even know how many. It might be 50 different items that you can make Eat Fit approved. The Thai beef salad, I love that we're creating this today because a lot of people have a misconception about beef and they think, oh, it can't be healthy. But, 2 ounces here on this salad, and the filet? Filet is actually a very lean piece of beef. So you can actually enjoy red meat, but also be Eat Fit approved. And look how beautiful this is. It's lots of different colors, lots of different vegetables. Can't go wrong.
Chef Loma, how do you get started if you want to do this at home?
Certainly. So we're going to start off by searing the beef. Usually throughout any restaurant, we always start our mise en place. So a lot of the production will get done throughout the day. We're going to do a little bit of kind of the production. And this is easy to take care of at home. So if you are wanting to execute this at home, you can visit like a local farmer's market, a local grocery store.
And what exactly do you have here?
So we have cilantro, matchstick carrots, bean sprouts, cherry tomatoes, red onions, and then cucumbers.
Those tomatoes look very tempting.
Yeah. And then the dressing literally consists of fish sauce, sugar, water, sliced Thai chilies. And even if you don't even need to go with Thai chilies, you can go serrano peppers, jalapenos. So there are alternates to kind of doing this. So we'll start off with a hot pan. Usually in the restaurant, we actually sear on the grill. We're actually going to sear in the pan.
And Lauren, you said these are about 2 ounces together, or
yes?
Each
So
one?
2 ounces is going on the salad. And the whole salad is 110 calories, 15 grams of protein. So it's really a great starter. You don't have to feel like, oh, I had a salad, I can't really get a big entree. You really can.
Wow, that's incredible. That's so low in calories. Is there a secret to preparing very flavorful beef? I mean, did you prepare this a certain way before you put it in the pan?
For us, we salt and pepper. Prior to arriving, we salt and pepper this.
It smells great. You smell it?
So it's literally one quick sear, and then for us, we always let it rest. So the difficult part as a consumer, when you're actually cooking at home, we like to let the beef rest. I think that's a beautiful thing, just so it can retain all the flavors and the juice within the meat. And I think slicing it too quickly, it'll just start to let go of its own juices.
I think that's a great little secret there.
Yeah, absolutely.
And once you sear it, what do you do next?
So we are gonna slice our beef, then make our salad. As sushi chefs, we have very sharp knives.
I could see that.
If you don't, and if you do need a sharp knife at home, I always recommend going out and getting like a boning knife or a fillet knife that you can pick up at a local department store. Super inexpensive, and at the end of the day, it's easy to kind of manage.
Do you have to do super thin slices or more thick? I'm trying to see your finished product there. What do you recommend?
We do slightly thin, thick. Kind of in between, where it's more palatable, as far as when you're eating it, it's not too thin to where it kind of just super dissolves, but it's where you can kind of have the combination of the beef melt in with the cucumbers and all the other ingredients. So we're gonna slice the beef. Nice thin slices.
Looks nice inside.
Yes. So,
looks beautiful.
And letting it rest for a bit will make it easier to cut. The difficult part is if you are trying to cut this while it's still hot, the seared part of the beef will start to tear. So letting it cool down, kind of tighten back up into itself, will make it a lot easier to cut at home.
Well, Chef Loma is going to be mixing some other things for us. Lauren, tell us about some of the Eat Fit approved items. You mentioned that, of course, there are a lot of different combinations, but I know there are probably some super popular ones at Tsunami because Tsunami is such a popular place.
Yes, absolutely. So at Tsunami, it's important to know that you can kind of make it your own. So they have brown rice options, they have soy paper, they have cucumber, they have no rice if you're trying to do lower carb. So you can absolutely ask your waitress or waiter to make it your own.
Which is such a nice thing to be able to do at a restaurant.
Yeah, absolutely.
More in control.
They have, I believe it's called the Pimp Salad.
Yes.
That is by far my favorite.
It's a very popular salad.
It is so good. I highly recommend going in and trying it. It's so beautiful. Definitely Instagram worthy of putting that post on there.
Chef Loma, I see you took all your wonderful fresh ingredients and put them together.
Yes.
What did you drizzle?
So that is our Thai beef dressing, and that's actually a sauce that we make in house. It's a fish sauce, ginger, garlic, water, sugar, and we make that primarily in house. And it's specifically done for this salad. It's very light, it's very clean, and it's something that with the click of a button you can research online and even make at home.
Gotcha.
And then he mentioned fish sauce and sugar. So fish sauce is normally high sodium, and then sugar, has all your added sugar. So you kind of want to monitor that, but it's fine as it is into something. There's only a quarter ounce that is actually going on this salad. So everything kind of in moderation. Yeah, with sugar, fish sauce, a lot of herbs and spices in there, but combined together, 110 calories, you can't go wrong.
Incredible. So once you mix your other ingredients, you just whoop.
Right, we're gonna toss. Now we're actually gonna.
See, I'd have trouble with that at home.
Yeah,
plate.
I would probably have to do the tongs.
I'd lose some of my calories on the wall, on the floor.
It takes a while within the culinary industry, but you end up picking up little tips and tricks that make kind of the production
That looks
aspect.
so pretty.
So, and after that, we're going to take our beef, place it right on top.
Wow, that looks so simple and delicious.
And then just garnish with picked cilantro leaves.
And you can tell that this beef is very high grade. The purple/red in there kind of shows that.
I know, it's a very
Beautiful.
distinct color. It looks great. This was, I can't believe, not that you didn't, spend a lot of time preparing all this, but this seems like something you could really do at home.
Yeah, within a matter of 10 minutes.
Wonderful.
Yeah.
I'll tell you, I guess if you're Tsunami Sushi, maybe you can order 2. So she's so low in calories. How did you all partner up? It sounds like you have a lot to offer an organization like Eat Fit NOLA. Was it just a natural fit?
It was definitely a natural fit. One of our ambassadors, Emily, actually onboarded them, and it was just organic. We really worked together and created that build your own kind of mentality of you can do the brown rice, you can do the cucumber, you can do the soy paper wrap, or no rice, and still having all those fresh flavors come out. It's really nice.
And I know Tsunami Sushi likes to really engage their patrons, and you actually do classes too, right?
Yes, we do private classes. We also do omakase, so if you decide that you want to come join us and kind of do like a chef's course, we do that as well. But we do private classes where you can come in, learn to roll your own sushi, which is perfect for holiday events, birthdays, any special event coming up. And it's always fun because it becomes less of a dining experience and more of a memory. And I personally love sushi classes because it's very hands-on and it's very rare to see within the sushi market. So being taught sushi with a professional sushi chef is always fun.
Anything to get your hands dirty in the kitchen.
Absolutely.
I do want to mention real quick your aficionado club, which I think is awesome. It's like you get a rewards program when you get sushi. I wrote down some notes here. You can earn double points for dollar during weekday lunch.
Yes.
Every 100 points earns you a $10 credit on your card to use for your next visit. You get a free sushi roll on your 10th visit, and sometimes you even get preferred seating if you flash one of these cards, like little VIP James Bond cards. That's pretty awesome. How can our viewers find out more about Tsunami Sushi?
Certainly, you can visit our 3 locations. We have one in Baton Rouge, one in Lafayette, and then one in New Orleans.
And they can find you at the one on Poydras Street, is that correct?
Correct.
And Lauren, tell us about Eat Fit NOLA. How can our viewers find out more about that?
Yeah, absolutely. So you can go on our website, eatfitnola.com. We also have a free Eat Fit app that has all of our partnered restaurants on there, the nutrition facts for this dish and all the other Tsunami dishes that they have. And come check us out.
And we will also be posting this recipe on our Facebook page and at communityhealthheroes.org. Thank you both for coming today. This looks so pretty, and I'm so dying to taste this. It looks delicious. We'll be right back.
My mother was always very active and independent, and she was familiar with her neighborhood. But one day she stopped at the stop sign for much longer than usual, and she didn't know whether she should go forward or turn or just stay at the stop sign, and she wasn't even really sure where she was at. It was very unsettling for her.
It's important for you to talk to someone about it, to bring the family in on it. I felt so much better after my son told me, "Mom, I don't want you to worry or be afraid. I'll be there for you and we'll figure it out."
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurants, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we've provided you about how to prepare yourself for hurricane season, the warning signs of a stroke and what to do if you think you have one, and a healthy and nutritious recipe for Tsunami's Thai beef salad will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.